Hello, language learners. Welcome to the IELTS Secrets podcast, your passport to mastering the English language and achieving top scores in the IELTS exam. I'm your host, Neil, an English instructor from the beautiful landscapes of New Zealand, here to guide you through the intricacies of the speaking section. Today, our focus is on understanding your country's health system. Describe the health system in your country. Here is our template. As far as the health system in my country is concerned, I would like to point out two important factors. Firstly, and then mention the first important factor. Secondly, highlight the second important factor. Here is our Band 9 speaking response based on the same template.
Describe the health system in your country.
As far as the health system in my country is concerned, I would like to point out two important factors. Firstly, healthcare is publicly funded, ensuring that essential medical services are accessible to all citizens regardless of their financial status. Secondly, there is a strong emphasis on preventative care, with initiatives such as nationwide vaccination programs and public health campaigns aimed at promoting healthy lifestyles.
Question 2. What's the procedure for seeing a doctor in your country? Here's our template. Well, we should take the following steps to see a doctor in my country. The first step would be, and then describe the initial step, then outline the subsequent steps. Finally, mention the final step in the process. Here's our Band 9 speaking response based on the same structure.
What's the procedure for seeing a doctor in your country?
Well, we should take the following steps to see a doctor in my country. The first step would be to schedule an appointment either by phone or through an online booking system. Then, upon arrival at the clinic or hospital, we are expected to check in at the reception desk and provide relevant personal and insurance information. Finally, the patient will be called in to see the doctor for their consultation.
What are the advantages and disadvantages of private health insurance? Here's our template. As for the benefits of private health insurance, one can expect and then list the advantages. Next, the second advantage of, and then mention another advantage, would be, and then explain the benefit. Despite the benefits that I've mentioned, a person might face such problems as, and then here list the disadvantages and explain why they are problematic. Here's our Band 9 speaking response based on the same template.
What are the advantages and disadvantages of private health insurance?
As for the benefits of private health insurance, one can expect faster access to specialist care and elective procedures, as well as greater flexibility in choosing healthcare providers. The second advantage of private health insurance would be access to additional services such as dental and optical care, which may not be covered by public healthcare. Despite the benefits that I've mentioned, a person might face such problems as high premiums and exclusions for pre-existing conditions because these factors can limit accessibility and affordability for certain individuals.
Question 4. Do you think a country's health system should be free? Here's our template. Well, I believe that it should be totally free only to those who, and then mention a specific group. However, those who, and then describe another group, should, and then explain what they should contribute because, and then provide a reason. A great example would be, and then offer an illustrative example. Here's our Band 9 speaking response based on the same template.
Do you think a country's health system should be free?
Well, I believe that it should be totally free only to those who are unable to afford healthcare due to financial constraints. However, those who are financially capable should contribute through taxes or insurance premiums because this ensures that the cost burden is distributed equitably across the population. A great example would be the universal healthcare system in countries like New Zealand, where essential medical services are provided free of charge at the point of delivery, but individuals contribute to the system through taxation based on their income levels.
Well done, dear listeners. You've now equipped yourselves with structured templates to navigate discussions on your country's health system with ease and confidence. Remember to incorporate these templates into your responses and watch as your speaking scores soar. Until next time, keep striving for excellence and remember, practice makes perfect.